Okay, so we've talked about one part of women's health screening. So the next part is about cervical screening. Now, faces like that all over the place. Now, I'm sure most of us are of the generation when we remember the old metal speculum. So times have changed. Now, so I'll do the presentation. So what is the cervix? The cervix is inside the vagina. It's the neck of the womb. Okay, so this part's the cervix. Your vagina, vulva, fallopian tubes, womb, ovaries. Okay, so all it does is it joins the top of the vagina to the womb. Okay, just sits there doing that. I'll let you have a quick read through that. So what does it do? Can anybody see? Do you want to borrow me glasses? So obviously the cervix lets things in and out of the womb. Okay, whether it's blood from your periods, whether it's sperm to swim up the mucus to get in to fertilize an egg, to stop bacteria getting up there. The mucus thickens to stop the bacteria getting up there, and obviously to let babies out. Let them out. You can tell that I've never had children. I know nothing about childbirth. So yeah, let's the babies out. So cervical cancer is cancer of the cervix, which is sometimes called the neck of the womb. Okay, it can affect anybody with a cervix. The incidence is highest between the ages of 30 and 34, which is probably way past our lifetimes, and it's very rare under the age of 25. And I'm sure we've all seen the people who are trying to get it reduced down to 18 because somebody's had cervical cancer and died of it. But remember, a screening program is to screen a large population for a single thing. So it's screening, it's trying to detect the things before they become a problem. As with anything, there will be outliers. There will be people that get cervical cancer when they're 18, same as there'll be people who get breast cancer when they're 25. But we can't possibly screen the whole of the population from the minute they have a cervix till the end of time, because it just wouldn't work. So they target the age groups that are most at risk. Okay, so we also have to consider trans men and non-binary people who have also got a cervix. Just because somebody is living as a man, if they were born a woman, they've got a cervix. So they also need cervical screening, and they often fall through the cracks. We don't have so much of it in this area, I don't think, just because of the general population, but in more areas where there's a more diverse population, I'm sure that's much more of a challenge from there. And unlike the female cancers like breast, endometrial, vulval and ovarian, it's not known as a genetic cancer. It's a lifestyle cancer, isn't the right term, but it's not a genetic type of cancer. It's not like 1 out of 7 women will get cervical cancer like with breast cancer. So this is the important bit, because the cervical screening program has changed in the last few years. So, sorry, can you see? Because I'm wavering around in your face. Nearly all cervical cancers are caused by the HPV, the human papillomavirus. Now, I describe the human papillomavirus as like a common cold on your cervix. We pick it up and drop it off throughout our lives, and at any one time 80% of women have got HPV. But your body will normally clear it with your normal immune system. Okay, the vaccinations are offered to younger people because when you become sexually active, you are more at risk of getting HPV because it's a sexually transmitted virus. It's not a sexually transmitted infection because it's not problematic in the majority of cases. And it's quite nuanced, isn't it? That it's because if you tell somebody they've got HPV, a lot of them will freak out and they'll wonder who the partner's been sleeping with, and it's not like that at all. Honestly, I could be standing with it. Well, it'd been hanging around if anything's been. Edit that bit as well. Okay, so it usually clears up on its own without any treatment. There are some risk factors for cervical cancer. Age, like we've discussed, certain age groups are more at risk. Okay, smoking, because when we smoke, our immunity is less and cells regenerate slower, so, and they're more likely to become malignant. That's not the right word. It is the right word, but it's not the word I was thinking of, but there's my brain fog. Immunosuppressant drugs, because of course if you're immunosuppressed, you're not going to be able to clear that HPV yourself. And other sexually transmitted disease. If you've got HPV and chlamydia together, you're more likely to develop a cervical cancer. Okay? So, and STDs are becoming more prominent in older age groups, because there's a lot of people don't have a partner for life. We're not swans anymore. So, you know, around about middle age, a lot of relationships break down and people get with new people, and we're just not quite as savvy about STIs as the younger population is. So just to put that out there, just in case anybody is getting jiggy with anybody new. Anybody's getting any sexy time at all. So there are some symptoms of cervical cancer. Please stand up and show us all what you were.
I've been single for a while, and now I've joined Tinder and I've got 2 dates.
Ooh.
These two, as soon as you said first time in life I've blushed.
Yet. So there are some symptoms of cervical cancer, and just the same as with breast cancer, if you have symptoms that you are concerned about, you get them seen to. You don't think, well, my smear test's due in a few weeks, I'll wait until that. So unusual bleeding, especially after sex, unusual vaginal discharge, often smelly, painful sex, but sometimes there is no symptoms and it's quite advanced by the time it gets to symptomatic. However, most women with these symptoms don't have cervical cancer, but always think that you might have until you've proven otherwise. And I see a lot of people with these kind of symptoms and they've just got a really nasty thrush infection high up in the vagina. Treat that, everything goes away, everything's fine. But having a vaginal examination, somebody looking at your cervix, taking swabs is important. Okay? So it's important to see a clinician even if you're up to date with your smear tests. What is cervical screening? It's a free health test available on the NHS for all women between 24.5 and 64 years of age. I didn't even have to read that up there, did I? So, that's what it says there, which is pretty much what I've said. This is going to be a really poor video for YouTube. We invited every 3 years between 25 and 49, and then when we reach 50, we'll go to 5-year screening. Now, there is some, I know in Wales they've gone to 5-year screening for everybody, so that may well happen here. The reason that it gets a longer time in between is that we're just less at risk when we get older. So it's just a kind of catch-all when you get up to there. You can opt out of cervical screening. And a lot of ladies do. They either don't want it, they don't think they're at risk, or they've had an unpleasant experience before. So people can opt out of it. I mean, obviously we don't encourage people to do that, but if people want to do that, we'll support them, give the information and the advice that they need, and they can always opt back in just by making an appointment for a smear test. They don't have to do anything more than just phone up and make an appointment. So you can have your screening done at your doctor's surgery, which the majority of women do, but if it doesn't suit your working hours, then you can go to a gum clinic or a sexual health clinic. It all goes to the same database once it's been done. Okay, it's not looking for cancer. So when we're looking at somebody's cervix for cervical screening, we're expecting to see a nice healthy cervix. We take some cells to check to see if it's got HPV on it. In the olden days, and I'm talking just a couple of years ago, they used to look at all of the cells under the microscope. As you can imagine, that takes a human to do that. It's time consuming. It's also human failure often happens, you know, and that can be quite catastrophic. But because we know that the majority of cervical cancers are caused by high-risk HPV, what they do now is they screen for HPV first, which is much quicker. They just get the little pot, they don't even take the lid off, the little pot goes in like that, and it whizzes through the machine. The machine takes, because it's got little lines on, you've got to line the lines up, because if you do it too tight, the machine can't get the lid off. So it screens it. So it's just a big machine. So if you're HPV negative, you normally get a result within days. I like me sounds. Yeah. I don't have a sound for that. For that. So, if you are HPV negative, you'll just get your letter saying HPV negative, we'll see you in 3 years or 5 years, and then you'll get a letter in 3 or 5 years. If you're HPV positive, then somebody will look at the slides. We'll look at the cells under the slide. We did have a period before we went to the HPV primary screening where we weren't getting results back for like 6 months, because it was so labour intensive for one person to go through all of the things. So this is a much more efficient way, and it's catching a lot of early changes that need treatment or that need monitoring. Now, if you get an inadequate, it just means that they haven't got enough cells. But again, we're getting less and less of those now, because it doesn't matter if we haven't got the right cells from the transformational zone, which is the bit that we're trying to get into with the cervix. Because if they've got enough to test for HPV and you're HPV negative, it's fine. That's all we need. So we're getting less and less of these. We're seeing more in older ladies who are a bit dry. Because obviously if something's dry, you're not going to get very much cells off the top of it. So what if you test positive? It still doesn't mean that you've got cancer, and it still doesn't mean that you are going to develop cervical cancer. And that's when they look at the cells. So I always explain it as you need 2 things to create the perfect storm: high risk HPV positive and abnormal cells. Okay, but by doing the 3 or 5 year screening, we usually catch it before it develops into anything sinister. So, but done all of that, talk about that. So, if you haven't got any abnormal cells, you'll get another screening in 12 months to see if you've cleared the HPV. Some ladies just don't clear HPV, it's just there and it's persistent, and then they're obviously more at risk of developing cervical cancer. So we'll test it at 12 months. If you're HPV negative, see you in 3 or 5 years. If you're positive again, then they'll send you to colposcopy for somebody to have a look closer, just to make sure that everything's as it should be. Now I like this, but it's not quite right now because they've changed it. So now the check for the HPV first. So I can't work out what I'm doing with that. So anyway, I like that because it's how it used to work, but it just shows that 100 out of 100 women, then most women. So I should have stuck an extra patch on, shouldn't I? So out of 100 women, 94 women will have a normal result straight away. Of the 6 women who have abnormal cells, 4 will have to go to colposcopy, and the other 2, so that's 96. Oh God, I'm not Carol Vorderman. That's my disclaimer. 96 women out of 100 will have a normal result, which I think is pretty good. And that's HPV. Ta-da! I think it's quite pretty, to be honest with you. I don't think it's as ugly. I think you would, wouldn't you? So, we can pass the speculums round. So speculums come in lots of different sizes, and like I say, we all remember the big metal ones that were horrible, and they were all, I'm sure they were all the same size. We used to run them under the hot tap so that they weren't too cold when we put them. It was always horrible, wasn't it? But now we've got lots of different sizes, from tiny little virgin ones. Oh, isn't that cute? Catherine.
You look at the wall.
That's and so they come in different sizes. So that's a virgin one, so that's the tiniest one, and then we've got small, medium, medium long. So if you're tall, you might have a longer vagina, so we need a longer one so we can see up. If you've got a prolapse, or if you're carrying a bit of weight, sometimes we use a broad if we need to, just to keep the vaginal walls out so that we can see the cervix. There you are. Yeah, as a general rule. But yeah. Normally I would normally start with a medium size, because most women will be okay with a medium. If somebody's nervous, or if they're tense, or if they're older and they haven't had anything in the vagina for a long time, I'll start with a small. And most of the time, with most women, if they're in the right position, you can see a cervix with a small speculum. If some people's cervixes just pop out as soon as you put a speculum in, hello. and some of them you've got to poke down there, poke up there. I don't know if you've ever had to sit on your hands to tilt your pelvis up a little bit so that we can see it. You know, there's always a way to find a cervix.
Can I ask about, so everyone knows about my vagina. I mean, now do my screening, and I know that we don't use KY jelly anymore because of the dryness that's happening.
No, we use a different type of gel.
So you would use something, because that is something that I am worried about.
Yeah.
Because I'm worried that whatever we use will irritate, because
It's still a water-based gel. It's still a water-based gel, but it's got smaller molecules than KY jelly. Otherwise, sometimes it gets in the pot, which clogs up the HPV machine. Yeah, but what you could do is start using your estrogen every night again before you go.
I mean, I always ask them the same nurse who's done me screening for years.
I went for mine, and there was nothing to cover myself with, and there was nowhere to put my knickers, and I was like that. What am I going to do?
But I'm just wondering, because when I went for my coil to the city, that couldn't fit because I'm completely through, and that was the same in the surgery. They used to have a screen, didn't you?
Yeah,
You used to have a little bit of dignity and decency, and you would have a little paper, and they were just stood, and I thought, right, okay, I'll just have. There was no screen, so. Since then, I always make sure we've got a screen for the lady to go behind. They've got a piece of paper. There's a chair there for them to put the clothes on, so that you're not. Because the last thing you want when you're feeling like, I don't really want to be here in any way, is to think, where am I putting my knickers? What am I going to do with my knickers? It's uncomfortable.
Yeah. I always laugh though and say, well, here's a piece of paper. You want to cover yourself? It's not like I'm going to be all up in your fanny in 5 minutes. Should see us when we're doing coils. It's just we just laugh the whole way through. So that's the speculum. Now, in the olden days, again, the reason it's called a smear is because we used to use it. Now, we found these in one of our older GP who's now retired in one of his drawers. So this is what we used to use. This was before my time in GP land, but I remember these. And they used to put it in your cervix and scrape it around. And then put it on they have to wipe it on a slide, and then the slide goes. Now, I don't know about you, but you would always bleed. It would come back as inadequate because they couldn't look at the cells because there was too much blood there. Then you had to go back. So it was all absolutely horrible. And I find a lot of the women who are overdue the screening are in our age category because it was so horrible when we used to have it done. So having just a conversation with them on the phone saying, we don't do that anymore, this is what we do now. So yeah. It looks like a little bone, doesn't it? Looks like a little femur. A very little femur. A tiny femur. So that's what we used to use in the old days. I know, they're horrible, aren't they? So yeah, I found these in one of the old GP's drawers. I thought, I'm having them. So this is what we use now. these little brushes. So you can see we'll pass them around. They're really soft, and we'll just put them on the cervix and we'll just twist it around like that. They say to put a pencil pressure on. So we'll just twist it around 5 times like that, and that picks the cells up. You can have one there, and I'll send one over there. It's all right, I won't be putting these back in the... Yes. Yeah. Not as quick as that, because you've got to make sure you get as many cells. So we might just do it if you sometimes you just have to do it in there if the transformational zone's just in the middle there. But some people, especially people who are on the combined pill, they have what we call an ectropion, where the tissue from inside comes out, and that's very normal. So then we have to sweep it as well like that to make sure you get all of the cells from there. And then this is for people like Catherine with that tiny little dried up os. So if we can't get that one in enough, we can use this one. And again, it's still very soft, and that just goes inside and twists around like that. So you can see times have changed, and it's never going to be pleasant. Getting your fanny out in front of a random stranger is never going to be pleasant, is it? But you've got to think of the long game. What am I doing this for? And you'd rather be going to colposcopy to have some cells taken away, to have a biopsy, than to have a full pelvic clearance because you didn't have your cervical screening. And I've seen that in a 42-year-old woman in our surgery who hadn't been for a smear test for a long time, and by the time she did, we convinced her to come for a test, she didn't even need a smear test. She was straight away on a 2-week wait to gynae. And that will stay with me forever. Other examples of things that we can do to help. I had a lady who had a germ phobia, and that's why she hadn't had a cervical screening done, because she couldn't bear to think that it wasn't going to be clean for us. So we brought her in first thing in the morning after the cleaners had been in. So she was the first patient in there. We showed her the speculum in the packet, so she knew it was sterile, never been used before. We opened a new packet of brushes. We used sterile gloves, and she managed to have her cervical screening done because we'd listened to her concerns and we'd worked alongside those to make it easier for her, to make it more acceptable for her. And there's always ways and means that we can do things. Recently we had a lady who hadn't had it done because she had been in a sexually abusive relationship, and it just takes a little bit of extra time. It just takes somebody to listen to what your concerns are, and you're in control. That's not yours. Oh, you're in the duck bill. You have to remember that you are in control. If at any time you feel vulnerable, if you feel that you just don't want, it's painful, you just have to say. And any screening sample taker who is worth doing it will listen to you, and they'll stop, whether it's stop, right, we'll do this and then come back on another time, we'll try again, give you some vaginal estrogen to use, give you some Instilla gel, which is a local anesthetic gel to use before you come in. And we've got special booklets for people with learning disabilities. Just because they've got Down syndrome or they've got autism doesn't mean that they don't need cervical screening. But it's difficult for those people to understand why, what, and how we do it. But we've got information booklets for them, and we can get them in different languages. We're getting more Ukrainians and more Polish people in this area as well. And just listening to the lady and thinking, well, why are you not coming for your screen, and what can I do to make that happen for you?
Can I ask about so if somebody's had the HPV vaccine or injection, do they still have to have?
Yes, because the
rates going down as a result of that.
They are, yep. But the HPV vaccination only protects against certain strains of high-risk HPV. It doesn't cover for all. So we never say somebody's got no risk of developing cervical cancer. We always say that everybody's got a low risk, whether they're not sexually active. We'd always encourage every woman, because you hear stories, because I've never had sex for so many years, I don't need me screening. Well, you might have had sex 10 years ago and you might still have HPV from that time, so we never say no risk, and we'd encourage every lady to come and get it done.
And there's ways and means to do everything. You know, they can do them under general anaesthetic at the hospital. You know, if we need somebody to do, if somebody's having an operation for something else, they can do it. I mean, they would always get permission, consent beforehand, but they can do it under general anaesthetic if you're going to get something else done, if you need it done. So colposcopy. What happens at colposcopy? So that's a lot of ladies, isn't it? 220,000 women and people with a cervix are diagnosed with cell changes. And the treatments that they can use are, they can do biopsies if they think, not sure what that is, or they can take it away there and then. I've never had colposcopy myself, so I can't tell you from a lived experience. Yeah? Do you want to share, or would you prefer not?
So I had it lasered or...
The laser loop.
So
I can't remember what it's called.
and I could see it on the screen.
Yeah. Mm-hmm.
And you could see the different colours.
Yeah, because they use different solutions. They use vinegar and that brings out different cell changes on the cervix. Yeah.
Yeah, you feel afterwards like you've got a bit of a period pain.
Yeah.
You know, like a bit achy.
Yeah.
I've had the burn off, but I've also had it frozen as well.
Yeah. Like cryotherapy. There I go again with me noises.
I'll share. So unfortunately, I'm a wimp, and I went to colposcopy to go and get them burnt off or whatever it was, and they couldn't do it, so I had to go under general. She just didn't. It's a really tiny, small procedure, isn't it? But yeah, I was just too much of a wimp.
But everybody's different, you know, and it's not.
If you couldn't go through it, if you couldn't go through with it, then like you said, there are different options.
Yeah. So you know, I think a lot of women do feel I wouldn't be able to tolerate it or whatever, but you know, you could try it. If you didn't want to try it, you just tell them I don't think I can do that, and then they'll find a different way to do it.
I'm surprised that only 4 in 100 women have the abnormal cells then, because there's 3 of us here had so that just seems quite a low.
It's probably half or 5 of them.
So that seems very low.
Sorry.
That's each year.
Yeah. So
4 in 100 is still. 4
Yeah.
in 100 doesn't matter how it is.
But I suppose it depends what level of abnormal cells you've got, because we'll start with something called borderline, which is kind of like, is it abnormal, is it not abnormal? And a lot of those ladies will go to colposcopy, and then it goes up to low grade dyskaryosis, and then moderate, and then high grade. So there's lots of different grades. So yeah, but it did say that a lot of those women went to colposcopy. There was about 20 women in there went to colposcopy, I think, if I remember correctly, but I don't really remember. But yeah, it does. God, it's awful, this brain fog, isn't it? Maybe it's what gets speakers who aren't menopausal. So there's some resources for you. So that'll be on the website as well. So I hope that was informative for you all. Now, Tammy, you did mention that it is Ovarian Cancer Awareness Month.
Yeah, there's some sort of Facebook, I forgot what it was, but I think it's Ovarian Cancer Awareness Month this month.
Yeah.
And there was actually quite a lot of useful stuff on there.
Yeah.
What the symptoms are.
Yeah. So ovarian cancer is probably the most underdiagnosed female cancer. So by the time we normally diagnose it, it's very advanced. So things you're looking for is bloating. So if you're bloated, or not bloating going up and down because you've ate bread or you need a poo or whatever, but if you get abdominal bloating, that's just not going away. Again, anything that's not usual for you. And what one of our rules is that if a middle-aged woman, a woman over 50, presents with symptoms of irritable bowel syndrome, we'll do a blood test called a CA125, which is a risk indicator for for ovarian cancer. So you know, because it is so underdiagnosed, because it doesn't really give very many symptoms. So can you remember any of the other symptoms, Tammy?
I did look And I thought, oh, they're really non-specific.
Yeah, absolutely, and that's part of the problem.
And my sister's had ovarian cancer, and she was treated initially for symptoms associated with UTIs.
Mm-hmm.
Repeatedly, she had the bloating, she had massive bleeding issues that
Mm-hmm.
didn't seem to be fall within a period
Mm-hmm.
range. And strangely enough, there's, depending on where you look on the internet,
Mm-hmm.
and apparently if you get some kind of a rash on the palm of your hand, and I did a search based on her symptoms, and I said, you've got ovarian cancer,
Mm-hmm.
and we had a laugh about it.
Mm-hmm.
Because,
Is that the high circulating estrogen? You get palmarothema, you get red hands because of the high circulating estrogen.
and she had to have her ovaries removed,
Mm-hmm.
and she was told she had weeks, maybe 9 years to live.
Yeah.
And she's been here 6 years later, so she's doing amazing.
That's brilliant.
But it's because, I mean, she, as a medical professional, she was a health visitor,
Yeah.
and she went repeatedly
Yeah.
to her GPs,
Mm-hmm.
and she had loads of different courses of
Mhm.
different antibiotics for her
Mhm.
UTI,
Mm-hmm.
and basically she was stage 4.
Yeah. I think one of the most important things for me to tell you is if you are worried about something, tell your clinician, because your concern might not be my concern, and you might be thinking it might be this, and if you don't tell me that it might be this, I think it might be this, I can either say, you might be right, let's do these tests, either to put your mind at rest or to say definitively yes or no, or absolutely that it's not that, it couldn't be anything further from that. Because sometimes when you read the internet, and I'm not just telling anybody not to read, because there's lots of great resources out there and knowledge is power, but unless you tell us what your concerns are, what you think it might be, then we can't address those for you. But this one, the Eve Appeal, is a really excellent resource for female cancers. So they look at the 5 different, they do a lot of research and education about the 5 female cancers, which are vulval, ovarian, endometrial, breast and cervical. Yay, I got them all. I'm fixed. So yep, and Joe's Trust is probably the best website around for cervical cancer. Any concerns you have about cervical cancer, and obviously Cancer Research UK, and really the NHS one's probably the least useful. But I thought I better put it on there because I did steal some of the information from there.
So as it's been mentioned already, brain fog. And what's the frequency of vulval cancer?
Very rare.
Right.
Vulval cancer is very rare. However, I do refer quite a few ladies under the 2-week wait, because if somebody's got a sore vulva, whether it's lichen sclerosis, which is where everything gets dry and itchy and inflamed, whether it's that or whether it's just what we used to call vulval atrophy, you know, where it just gets dry and inflamed. I'm not a specialist in that. I don't have the tools or the equipment to say definitively to a lady, I know this is not vulval cancer, so I'd rather refer them. I have never had one come back yet, but I refer quite a few ladies with sore vulvas, but that's probably the rarest one. I don't know what the actual incidence is, but it's very rare.
Okay. So just to, I'm sure I'm not the only one. Obviously I do get very dry externally,
Yeah.
and I get sore, and sometimes my skin tears.
Yeah.
I just put that in I haven't been to group, I just put that down to
Yeah, as long as it's healing, as long as if you get a tear, it heals.
Yeah, after about a week.
Yeah. So that's fine, because if you think about if you cut another part of your skin, is it reacting in the same way?
Yeah.
So if it's reacting the same way and it heals within a week, fine, it's probably okay. But if you're worried, go and get a professional to look at it. And they can always refer you to gynae. Are you on any you don't have to share if you don't want to. Are you on any treatment?
Well, just my HRT, my
Right. Yay. So you need to go back and ask for some Hydromol and some Betnovate.
Right, okay. So I'll make a point to see you tomorrow.
Are you one of mine? Are you one of mine? You don't have to share that.
Oh, she's my, yeah. Sure.
Oh,
So every time she says about ladies waiting for the smear test, I think that's the last time you did mine.
Very ill.
I'm just going to have to set you out.
What you saying there? So I'm done. You can pay for it. You're